Hi, my name is Teresa Ray, and I'm going to be doing a head and neck assessment on Brianna Phillips. Bree, can you tell me how old you are?
19.
Okay, and when's your date of birth?
September 12th.
Okay, what year were you born in?
1996.
Okay, and what day is it today?
Tuesday.
Tuesday. Okay, all right, I'm just going to be feeling around on your hair here, okay? On your head. No masses are noted. Hair evenly distributed and smooth. Okay, no lesions, no scaling. Eyebrows are equal, evenly distributed, no scaling noted. Eyes symmetric, eyelashes full, evenly distributed. Okay, all right. I'm going to be looking into your eyes with this ophthalmoscope, okay? I'm not going to touch them or anything. There's going to be a light that shines into your eyes. You'll just kind of look straight over my shoulder, okay? Just find a fixed point back here on the wall, all right? Okay, I'm going to look into your right eye first at a 15-degree angle. Red reflex is present. Okay. Pupils are from 4 to a 2 millimeter. Constrict. Equal and reactive to light and accommodation in the right eye. Okay, I'm going to check your left one. Look over my shoulder. Red reflex present. Pupils are equal bilaterally. Reactive to light and accommodation. Pupils constrict from 4 to 2 millimeters. Okay. All right. Sclera is white. Conjunctiva is pink. No inflammation noted. No drainage, nothing like that. Okay. All right. Now, I'm going to be looking into your ears, okay? So I'm going to change this out. All right, this is an otoscope, and I'm going to pull up on your earlobe right here, okay, and kind of away, and I'm going to insert this in your ear so I can look in there, all right? First, let me look at the outside of your ears too. Your auricle, there's no masses, no tenderness, nothing like that, okay? The tragus, everything's normal, no abnormalities noted. Let me look at your other one. Okay. Everything looks normal. All right. I'm going to pull up on your auricle here, kind of away from your head, okay? Insert this in here, and I'm going to look in here at your tympanic membrane. Okay, grayish and intact. Look at this one. Okay, grayish and intact. All right, note your drainage noted. Okay, now I'm going to look at your nose, okay, and it's midline, and I'm going to look in your tubercles. Everything looks normal, no drainage noted. Septum, no deviation noted. All right, and lips look moist and pink. Now open your mouth for me. All right. Tongue, moist, pink. Oral mucosa, pink and moist. Teeth. All right, open up for me. Look around. Okay, stick your tongue out for me. Let me look in the back of your throat at your tonsils. Okay. All right, and your uvula. All right, everything looks normal. Okay, so we've looked at your eyes and ears, nose and mouth, assessed your head. Okay, we'll move down to her neck now. I'm going to check your trachea, okay? I want you to swallow for me. Okay, trachea is midline. All right, I'm just going to feel your thyroid gland here too, okay? Just kind of move back and forth. No masses noted. No enlargement noted. Okay, now I'm going to assess your lymph nodes, okay? There's 10 of them, so I'm just going to feel around, all right? Okay, we'll start with your ones right here in front of your ear. That's your preauricle ones. Okay. Posterior auricles right here behind your ears. Okay. And we're going to go to your tonsillar. They're right here on the base of your spine. Okay. And we're going to do, that's occipital, sorry. Tonsillar is right up here. Okay. Then we're going to go to submandibular and then submental. Okay, now I'm going to make my way down your neck here. We have superficial cervical, posterior cervical, then we have the deep cervical chain, and then we have the supraclavicular. Okay, all lymph nodes are mobile. No enlarged lymph nodes noted. Okay, neck is supple. All right, okay, so now we're going to move on to, we're going to assess your cranial nerves. So we're going to start with your cranial nerve number 1, which is your olfactory nerve, which is for smell, okay? So I want you to close your eyes. We're going to occlude one of your nostrils, so just take your finger and kind of press it up against your nostril there and close your eyes. And I'm going to put something in front of your nose and you tell me what it smells like, okay? All right? What was that?
Strawberry.
Okay. Occlude your other nose. And then what is this one?
Strawberry.
Okay. All right. Good. Okay. Now we're going to test your cranial nerve number 2, which is the optic nerves, okay? And that's in your eyes. So what we're going to do with that is the Snellen test, and or you can have a card, and I have some numbers wrote on here, and you'd be about 15 feet away, and I'm going to hold this up, and you just tell me what you're reading on this, okay?
E, A, 2, B, 3.
Okay. All right. That's good. Okay. Now, visual acuity, I would say, would be 20/20 then. We're going to move on to your cranial nerves 3, 4, and 6. They kind of all go together. 3 is the oculomotor, 4 is trochlear, and 6 is abducens. So I'm going to hold this pen, okay? And what I want you to do is just look at it with your eyes, and I'm going to bring it into your nose, and you just follow it, okay? All right. Okay. Now I'm going to check the 6 cardinal directions, and so I'm going to bring it to the far right, okay? And just tell me if it stays in your line of vision that you can still see it. I'm going to go right and up, and right and down. And I'll come over here, left and up, left and down. Okay, still see it? All right. Okay, and that was 3, 4, and 6. Okay, so we did 1, 2, 3, 4, now 5. 5 is trigeminal. For trigeminal, I want you to clench your teeth down, and I'm going to palpate your temporal muscles and your masseter muscles. Just feel the strength of them. Okay, that's good. All right. Okay, so now moving on to cranial nerve number 7, which is facial. I just want you to smile for me. I'm just going to look at your facial features, okay? Can you frown? Try to frown. Okay, lift your eyebrows. Can you lift, okay, and lower them? All right, that's good. Okay, that's good for facial. All right, so now we're going to move on. 8 is acoustic. Now, for acoustic, this is going to be my tuning fork. And so we'll do the Weber and Rhine test, and I would hit it against my knuckles to make it vibrate, and and then place it on top of your head, okay? Right in the middle of your head, and can you hear that in both of your ears? Okay, you can. All right. Okay. Now for the Rhine test, I would still do the same thing. Hit it with my knuckles, make it start vibrating, and put it on the back of your ear right here at the base of the mastoid, and then can you hear that in both your ears?
Yeah.
Okay, tell me whenever you stop hearing it.
I'm done.
Okay, and then I'll place it beside your ear, and you tell me if you can still hear it.
Yeah.
Okay, all right, and that would be the Weber and the Rhine test, and we tested her hearing. Okay, now we're going to move on to cranial nerves 9, 10, and 9, 10, and 12. 9 is the glossopharyngeal, 10 is the vagus, and 12 is a hypoglossal. And for these, I'm just going to have you swallow for me. Okay, now I want you to open up and say ah. Okay, we have palate rise with that. And then your gag reflex. Do you have a gag reflex?
Yeah.
Okay, all right. Okay, now the last cranial nerve that we're going to do is cranial nerve number 11, which is the spinal accessory or accessory spinal. And what I want you to do to check that is I want you to shrug your shoulders up. Shrug them up. Okay, all right, that's good. Okay, so we've done all the cranial nerves, tested everything. Now what I want to do is we're going to test her reflexes. I hope you can see her knees in this video. Let's get back just a little bit. I'm gonna move this chair back just so maybe you can see her knees a little bit. Okay. All right, sit back in that chair. I'm gonna look for the patella tendon here, and I will just do a quick little knot on it and see how her reflexes are. Okay, we'll come over here and do this side. Well, okay. All right, we're gonna say 2+ for the reflexes. And then what I want you to do with your arm here, okay, just kind of lay it here, just like that, okay? We're gonna test both sides. This is your brachial brachial. And so I'm going to just tap your arm right here, okay? And it's probably gonna turn in a little bit. Ready? Oh, fingers, wow. Okay, let's do this side. Okay, here we go. I am so sorry, that is not right. Okay, come on, Bree. There, that's better. Okay, so we did that. That's 2+. All right. I think we are finished with everything. I've checked all your cranial nerves, your lymph nodes, and everything's good. All right. Thank you.